Hello, and welcome to the Innovation Forum AI podcast, a space where we explore how artificial intelligence is transforming public health. In this episode, I speak with Gautam Prasad from Google Research. Gautam explains the Population Dynamics Foundation Model, or PDFM, an AI resource from Google that can potentially revolutionize public health decision-making. Hello, I'm really pleased to have Gautam Prasad with us. Gautam's a software engineer at Google Research and works on geospatial machine learning and in particular with the Population Dynamics Foundation Model and reasoning techniques using agentic LLMs. And Gautam and I actually had a chance to meet each other in person just a few weeks ago in Berlin when he came to a workshop that we were running. And it's great to see you again for this podcast. How are you doing, Gautam?
Yeah, it's great to see you. Oliver, it's really nice meeting in person as well, seeing the Berlin hub.
Yeah, it's great. Meeting in person is always a great opportunity to discuss things and connect. I mean, we've met a few times actually online about some of the work that we both do in this space. But I thought it'd be interesting to hear a little bit about maybe some of your career journey. And I know that you started off or at one point you were looking at brain connectivity patterns in health using MRI and machine learning. I mean, how did that lead you into your current work with Google?
In some ways they're very different because we're looking at MRI images of human brains and trying to study different brain diseases like Parkinson's and Alzheimer's. But some of the techniques, like computer vision techniques, are very similar across that domain, across things like facial expression recognition and even geospatial domains. And so the types of machine learning tools and the new versions of neural networks and LLMs that have come out are all translatable across each of these. And for me, one big benefit of working in the geospatial domain is there's huge amounts of data that can power these types of new machine learning techniques, which is a huge advantage to see what's possible and how we can hopefully improve people's lives.
So Gautam, you're working with Google Research. Maybe you could describe what Google Research is.
Google Research is one of the big research teams at Google. They have a big, long history of innovation. They discovered transformers, a lot of the underpinnings for LLMs today. A lot of the work we do now is coming up with very innovative new capabilities. A lot of this is related to LLMs. And a big focus for us is social good. How can we help the world, especially in disease tracking? How can we empower people to take novel research and run with it and own it and independently use it, and empower many people at the same time. And we care about publishing this work, making sure it's externally validated and accessible as well. And all of this Earth AI and population dynamics work is in that vein and how we can try to affect the world with these new capabilities.
In particular, we've been talking about a piece of work or an initiative that's you're heavily involved in, this Population Dynamics Foundation Model, or PDFM. Maybe you could explain a little bit more about that and how it came about.
So the idea is that we wanted to create a tool for helping with health applications and public health applications like we're talking about today, and do a lot of the difficult computational work and data processing work so that we could come up with a set of features or data that was useful downstream. And I'll give some concrete examples. For example, the way we first studied it is in the US, we can have census level data related to health. This could be something like asthma prevalence or risk across the country. And it might be that some parts of the country have very strong infrastructure to look at hospital records, to do surveys, and we have a really strong idea of the prevalence of asthma in those regions. But for other areas, those statistics might be delayed or they might be missing completely. And so one way you can apply this model is you can fill in those missing data sets or gaps. So there's a part of the country where all the zip codes or postal codes don't have these statistics. You can use this model to predict and fill in all of that and get insights into what's going on in these areas, even before a survey or some kind of statistic from hospital systems come out. Another really useful example is we might have statistics at the county level, which is a relatively large administrative level in the US for something like diabetes prevalence. But for it to be actionable, we might want it at the postal code level, because then we could apply interventions and figure out, like, how do we solve this problem? And the way you can do that is use this population dynamics model to understand the relationship between counties and diabetes prevalence, where we actually know at that level what's going on. And then we can use that same model relationship to apply it at the postal code level and fill in those gaps and come up with like super resolution of this statistic. And the way this works is that our population dynamics model is functional at both the postal code and the county level. So if there aren't statistics available at that higher resolution, we can fill in that gaps using the model. And when we studied this, we found that using our technique, which is a graph neural network and a bunch of different data sources like search trends and maps and weather and air quality, we were able to get state-of-the-art results. And we can do this in a very computationally efficient way and provide it to people to try it on their own as well.
That sounds really cool. I mean, it sounds similar to an approach using, let's say, more classical statistics of borrowing strength when you have, let's say, subsets of data where it's got more detail, and then you can use it to either infer or impute data into different parts of your data sets where maybe you have missing data. It sounds something like this, but on a much, much larger scale.
Yeah, exactly. Typical approaches like imputation use existing statistics and try to like interpolate them across missing areas. And the key difference with this new set of foundation models is now we're applying a lot of external data and modeling techniques to fill in those gaps in a much more data-driven way.
Wow, that sounds really cool. Is there a limit? Is there limits to the number of different data sets that you could use, or I guess the limitation is that how much compute resources are required. But can you just continue to ingest more and more different sources of data for the model?
Yeah, I think in theory you could keep adding data, but one of the things we've tried to be really careful about is that each data source is providing a benefit, and we're incrementally improving performance. So it's possible you could throw in like hundreds of data sets, but only a subset of them are actually useful. And there's like a computational burden for mapping them all into some useful set of features. And we tried to be very careful to show that each one was actually important and useful. But the approach of foundation models is to try to incorporate as much data as possible and then map it to a form that's really useful for people downstream to use when they're trying to track a disease or look at some kind of health statistic.
So, Gautam, you've mentioned super resolution a few times. Maybe you can explain to the listeners what super resolution is.
You can think of super resolution. Oftentimes they'll have it in detective shows where they keep zooming in on an image, and the actual resolution of a security camera doesn't have that. But if you want to go in deeper and deeper and deeper, you can use AI tools to come up with a better resolution so that you can look at very fine-grained details. And I'll give you an example. So Boston Children's Hospital and Harvard have looked at measles vulnerability in the US. And a lot of the current statistics are at the county level. And for it to be actionable, we want it at the postal code level. And the postal code or zip code level is much higher resolution or smaller than the county. And the whole goal of super resolution is go from a low resolution or like a very large area in a country to understand some health statistic at a very fine resolution, like a postal code. And so that process means that you might have one number talking about the number of vulnerable people for the measles disease at a county level, but then you need to somehow get the information of like every single zip code in that county. Maybe there's 20 zip codes. What is that statistic? Which is a very difficult problem because you're taking one number and then suddenly making it 20 numbers at a fine resolution. And if you don't have external information or external model like population dynamics, it's very difficult to do this, almost impossible. But using these modeling approaches, we're able to take that one number and map it out into all of the different variations of it.
And so it's like zip code, really the finest grain or the kind of highest resolution that you can practically go to, or could you go even lower than that?
The main constraint here is where is our underlying data available. And for most of our experiments, we focused on postal code, but you could rely on remote sensing data that might be at like 30 centimeter resolution to go much finer grain. And so that might be an example where you rely on different modalities and models to go even deeper. And especially like in countries where internet penetration might be worse, you could go finer grain by augmenting it with some kind of satellite embedding as well and do the super resolution task.
So one of the outputs of the foundation model or the population dynamic model are embeddings, and those are the things that you make available to other researchers. Maybe you can describe what embeddings are for the listeners.
Yeah, a lot of these foundation models. So there's population dynamics. There's another one based on remote sensing or satellite imagery called Alpha Earth. And the way we make these accessible for people is using embeddings, or you could think of these as features that are extracted from some kind of model. And at the end of the day, these features represent some data. They're a list of numbers that describe a specific location. So you could think of a country, it might have many postal codes, and for each of these locations, we have an embedding. But what that embedding really means is you have like a list of 300 numbers that describe it. And so if you want to do forecasting, you want to do extrapolation or imputation, you use these lists of numbers to run those types of models for you. And we're trying to distill all of that information and all of those capabilities in these big models like population dynamics or Alpha Earth into something that's easily accessible. So you can think of this like as a data set that represents many different regions and that you can use in your own model afterwards.
Great. So really a numerical description of our world around us, allowing us to then do kind of run routine statistics or modeling or even advanced statistics using these embeddings, right?
Exactly. And I think the embeddings are like some technical term related to how machine learning models represent data, but in practice, it's a list of numbers.
And so if we were, for example, shifting focus from, you mentioned asthma, but let's say we wanted to focus on another type of disease or an infectious disease or an outbreak, and we use the foundation model, can we supplement with maybe new data as we collect it to enrich what we're looking at, or is it dynamic like that in that way?
Yeah, I mean, there's a really good example. Actually, when I was at the Berlin Hub, I saw the first version of this paper from Moritz Kramer's group at Oxford, and they were studying dengue in Brazil over time. And there's a whole bunch of forecasting approaches to try to predict the progression of the illness in the country. And we were able to use the population dynamics model in that country, and they were able to experiment with it. And the idea here is that when you're using a forecasting model, you can incorporate population dynamics into that because it provides a kind of prior or a description of different places across, in this case, Brazil. And what this means is when they're making their forecast, they can adjust it depending on where in the country they're making that forecast. And what they found is that if you're making forecasts out 6 months or 12 months, if you use population dynamics, you can reduce the error. So it's similar to making a prediction a month out. So it can drastically increase your ability to know what's going on in the future. And in this case, there's a huge amount of prior data on dengue rates. And what you can do is augment that with population dynamics, because then you're getting this really rich information about what's going on in different areas of the country and adjust how you think dengue will progress in those regions.
That sounds like a total game changer. I mean, in infectious disease modeling, we've often really been limited to really just a few weeks out with any reliability. So being able to really look at these things, I guess dengue also has a lot of seasonality in it as well. But diseases where we have good time series sound like perfect use cases for combining it with PDFM.
Yeah, and a lot of the modelers I've talked to for disease say that each new outbreak is a brand new, and it's almost like starting from zero. And the idea here is with the population dynamics model is there's some rich prior about how a country is operating, how these regions are incorporating human behavior and the environment, and how cities are structured to be able to inform our predictive models that map out infectious disease.
Yeah, it's really great to see this in reality. I mean, we've been in this field, we've been talking about these things a lot for, a decade or 2 decades, that, really understanding the context in which a disease event is happening is kind of critical for being able to really understand what the epidemiological dynamics are. So it's incredible to see it coming into reality. It's no longer science fiction. You gave an example from Moritz Kramer's group about dengue in Brazil. So obviously the PDFM is not limited to the United States. It's applicable in other parts of the world.
Yeah, we had an original paper in 2024, and since then we've updated the population dynamics model using categories that represent the underlying data sets. And what this enables us to do is if there's information that is language specific, it's actually mapped to a general category. So what this means in practice is that if we have our model operating in Germany and we have it operating in Brazil and there's a language difference, it doesn't matter. We're able to make it language invariant and apply the model in different places. And so one of the tests we've done to check that this works is there's this Eurostat program. We can grab things like GDP, death rate, fertility rate across European countries. We've created our model in each of these countries. Then we could learn something about, let's say, GDP in a set of these countries using the population model, like Belgium, Germany, Switzerland, and then try to use what we've learned there and recreate all of those Eurostats in France. And we found that works really well. And it tests that we can actually apply it across countries, where there might be one country with a set of rich statistics about health and disease and socioeconomic variables, but another that doesn't. And we want to be able to translate everything we've learned from one country to another. And that's a big technical feature that we've been trying to enable to apply this to many different places.
Wow. And I mean, I guess this is a difficult question to answer, but I mean, how do you consider one country to be similar to another? I guess the example of France and Germany may be reasonably straightforward, although maybe the French and Germans might think they're completely different countries, which of course they are, but maybe they're more similar than, let's say, France and, I don't know, maybe Fiji or, I mean, how are you thinking about the similarity between countries for this approach?
The idea would be the population dynamics model for each of these countries has a very unique representation of what's going on. This could be the way cities are structured, buildings, the way people are moving around them, the types of things they're thinking about, where they're working, even weather patterns. All of that's very unique to that country and is an important feature to have in this model. And then those health statistics or economic statistics are tied to those people as well. And the way this works is that we identify the general relationship between, let's say, disease prevalence and our model in that country. And so, for example, in Germany, you might come up with some relationship between health statistics and population dynamics. And that relative relationship might be very similar in Fiji, even though that like the types of buildings are different and the weather patterns are different. The model will immediately adjust to those differences, and hopefully be able to provide a relatively accurate prediction in those places. That's kind of how it works. And part of this is having a shared vocabulary representation across places, even though the actual frequencies or statistics are very unique to a country.
So actually working at scale in this for this instance is actually a real win, right? The bigger you can get, the better the model will be.
Yeah, exactly.
Wow, that's really interesting. I mean, it also seems to me a great opportunity to try and address in some way, even if it's a bit of an oblique way, but to address some issues around data inequities, right? Because one of the problems we have in public health is there's some parts of the world where we just don't have a lot of data. And without data, somehow those populations don't, get counted sufficiently in terms of whether it's, public health programming or public health interventions. Presumably this can also address some of those challenges.
Yeah. And one part of this is having multiple sources of data. So, for example, a lot of the signals that go into PDFM are based on internet penetration in a country. And one way we can augment this is by adding other signals. And so Google has another model called Alpha Earth, which is a satellite foundation model. And it's trying to aggregate many years of satellite information. And this can augment the population dynamics model where there might not be as much internet penetration. And we've studied combining Alpha Earth with population dynamics. And we found, for instance, all of our health metrics can be improved, especially in places where there might be some disparity in information.
I think, if as data sources get better and better over time, which I think inevitably they will, right? I mean, in all parts of the world, internet penetration is bound to increase and digital data is bound to get better over time, then presumably the models will just continue to improve as we move forwards and combine them and use them for different purposes. But beyond public health, are there, other population foundation models useful for other applications?
One of the big things we've been working on at Google recently is called Earth AI, and it kind of builds on what we've been talking about. The assumption is that, let's say there's a crisis that happens. To fully address it, you don't look at just weather data or one specific model. You really need like a collection of foundation models and data sets and statistics and knowledge about how to address it. And one of the things we've been experimenting with using agentic capabilities using LLMs. And this is where these LLMs can reason for you and decide, let's look at a bunch of different data sets like Data Commons, which is a big repository of census label statistics from all over the world. It can look at specific queries related to maps and aggregate them together. And so we found that in many types of scenarios, if there's like a cyclone or a flood, we can aggregate a bunch of statistics from all of these really important geospatial data sources like Earth Engine or Data Commons to come up with a plan and understand the impact of a disaster on a vulnerable population. And before, this might take people a week of a bunch of experts coming together, picking all the data sources, coding up a lot of important things. And now with all of these new agentic capabilities, we can ask open-ended questions and rely on the intelligence of these new LLMs to come up with a pretty good plan and utilize all of these different foundation models together. So for example, in the case of understanding how a cyclone might affect some vulnerable population, we can use a model to forecast the cyclone. We can use the population dynamics model to understand vulnerable populations at a higher resolution using super resolution. We can understand economic issues that might occur using some forecasting model and combine these together in a much more comprehensive system to address these types of problems.
And the agentic component is what? Is that allowing us to interact with a whole suite of different models in a kind of more conversational way? And, if you're the crisis manager, let's say in a country which is going to be impacted by a cyclone, you can start working with the agentic model to start understanding the impact and some of the responses. Is that how you're building it?
Yeah, exactly. It should be a conversation. It might be first looking at the trajectory of a cyclone, then it might be like listing a bunch of relevant statistics, even relying on the agent to suggest reliable and high quality data sources to make these decisions. And one of the aspects here in practice, it might not be clear exactly what statistic is most relevant. You have to explore what's going on in the country. What are all the implications of a disaster happening? What are all of the groups here that might be vulnerable? And then try to come up with next steps based on that information. And part of that can be relying on the agent to suggest important things, but also a human needs to be in the loop to make decisions. And one key unique aspect here is before it might have taken a lot of technical effort to pull out these relevant data sets or models, or even understanding how they work. But now we can automate a lot of this with agents that intelligently go in and pull out the relevant information and give a human a lot more capabilities and power to know what to do next.
Yeah, I can totally imagine how that's going to be a huge time saver. I've been involved a lot in my career with actually doing the kind of hands-on approach or the kind of old school approach of pulling all of those data sources together. And you're right, it takes at least a week or even more sometimes. And it can be a little bit unreliable depending who's working on it. And there's a lot of variation in quality and scope as well, depending on what data sources are available. So I could totally see how, having a kind of an agentic component to some of this would be helpful for different kind of crisis response.
And even for us, this is new, like cutting edge research for us. And we would really benefit from collaborating with people like you and like people in the WHO in general to understand what other functionality we need, what other data sources do we need, how do we make this system work better, and hopefully impact people's lives positively throughout this process and be able to address crises and outbreaks really quickly as well.
Yeah, totally. We were, very excited, when we were chatting in Berlin about some of the potentials here. I mean, we're also working with Google Research and you and your team to look at how we can make some of these models more available and how we can learn together about using them in a public health space. Do you want to describe a little bit about, how we're going to go about doing that and how we can start learning about these models for public health practice?
We've open sourced a lot of the codes and tools. Those are on GitHub and people can go and download them and play around with them. You can contact us at pdfm-embeddings@google.com to understand if we can use and partner with population dynamics in a specific country. But oftentimes, I think this is grounded in a specific illness or health statistic that someone wants to study in a country. And that would hopefully improve people's lives if we better understand it and can better forecast it in the future. And if we're able to come up with a scenario like that, I think the population dynamics system and Earth AI in general might be a benefit. And the process would be to try it out, see if it is able to come up with something. The hope is that with this amount of data, modeling and automation, our baseline using the system will be much better than what we've done in the past. And hopefully it comes up with actionable insights for each of these countries. And people can provide feedback on maybe it didn't work in certain regions, or it would be great to have more kind of nowcasting versus forecasting capabilities. All of that is really important feedback to try to iterate on this system as well. And the hope is to make it very accessible. Like you said, you can ask a question to the agent in normal language, and it will start like giving you statistics and information, and then you can keep having a conversation to understand what's going on and drill in deeper into some statistic to make sure that it's grounded in like solid data, and can be used for an insight and some decision afterwards.
Wow. And for people who want to, start using the model or engaging the model, do you need to have a lot of computing capabilities to use it, or can you access it and just work on a normal computer? Or, from a user perspective, what's needed?
Part of the whole foundation model value proposition is that we've done all the heavy computational lifting. And you can think of it in practice as a data set that describes each different administrative region in a country. And we have these Google Colabs, which is a bunch of Python code where you can run super resolution or nowcasting. And for most of the time, if you're running that in an entire country, it should take a minute to compute and run over these embeddings and give you some statistics. And so it's meant to be a really fast iteration process where it's almost trivial once we give you our foundation model in a country to actually use it.
So you're running it like in a cloud, or you're not running it locally, or
you can do it both.
You can do both. You can do both.
Really quickly, yeah. It doesn't need any special GPUs or TPUs. You can run it on a normal computer, and it should be pretty quick for most purposes, like extrapolation and interpolation. For things like forecasting, we have tools that will run the heavy lifting forecast model for you on the cloud. But that to make that much more computationally efficient.
Well, so if you by designing it that way, that makes it super accessible for anybody as long as they have, I guess, a minimal internet connection and electricity and a computer.
Yeah. If you can, like one scenario, like there's all these great cloud resources available to automate a lot of this, but downloading the data set from the population dynamics model, and then having your internet connection cut would be worked as well. You should have enough there to run some experiments and models.
That's
something we've noticed too, is in public health scenarios, the size of all the data used for modeling is actually very important given people's limited resources. And so that's something we've tried to be really careful about to make sure that it is accessible for people running experiments and having very tight timelines to do so.
Yeah, exactly. I mean, all of this sounds like, we work in a lot of environments where, you have unstable internet or unstable electricity, but also in scenarios where you need to have answers very quickly, and you can't, wait for, long runs or, sending off for, computing, or running some calculations from, somewhere else centrally and then send you the results. So that sounds really just perfect. So Gautam, I mean, where do we go next? I mean, it sounds like science fiction coming to reality, at least from a public health perspective. And we spoke a bit about how we're working together and with other partners to use these models and test them out and see where they're strong and where they can be improved. I mean, kind of how do you think we should go forwards?
Well, some of the things we've been developing, like having the model work in multiple countries, testing that to see if it actually helps different disease. There's many examples of using like super resolution for polio risk or measles for like studying it to extrapolate statistics around the country. Another big thing we are releasing is a temporal version of the population dynamics model where we have updates every month. And we're trying to get feedback on that to understand, does this improve performance? We've done our own studies on COVID, flu, and RSV in the US and found that a temporal updated version of population dynamics significantly improves results. Another aspect is we're releasing this Earth AI framework, and this allows combining population dynamics with remote sensing models, with weather models, and seeing which one is really driving the improvements in disease understanding and forecasting and maps and insights. And I think the next steps are trying them out on as many problems as possible so that we can iterate on this system and come up with something that works really quickly and is as automated as possible, where someone doesn't have to go in and have a lot of technical knowledge about the details. And if we can figure out how to make this process as smooth as possible, I think that'll benefit a lot of people's lives.
Yeah, I strongly agree, and I think that all of this approach, again favors the kind of collaboration, the global collaboration that's needed here, and of course that's something that we're interested in particular. But I think as many people who use it in many different contexts are going to really help improve things. Yeah. Great. Well, thanks so much, Gautam. I mean, it's been a super interesting conversation. Any other final thoughts about PDFM, LLMs in public health, or any other kind of take-home messages that you'd like to leave us with?
I think the big opportunity here is with agents, with these foundation models, with all of these tools and data sets we have available, we can significantly improve all of our health and disease tracking capabilities. And so it's one of the best times possible to try out all of these new techniques and kind of throw them at different problems to see how well we can help people's lives. And I think that's a big takeaway here is it's a very important moment in our ability to affect pandemics and disease in general, and we should embrace it and try it out and see what benefit we can get.
Yeah, great. You mentioned there's a website for people who want to follow progress. Can you remind us again what that is?
You can contact us for PDFM-embeddings at google.com, and then we'll have some blog posts about Earth AI and some forms that people can sign up for more access and to try out the tools themselves. You can search for Earth AI, and hopefully that'll all pop up.
Yeah, we can put some links in the show notes as well for listeners who want to access it directly. Well, Gautam, thank you so much. It's really great. I really enjoy discussing this with you, and I'm really looking forward to seeing some of the collaborations as they grow and the use cases for PDFM and public health. And I guess it'd be great to come back at some point in the future and see where we are maybe in a year's time.
Yeah, thank you, Oliver. Really looking forward to see what happens in the next few months.
Great. Thanks, Gautam. Thanks so much. Thanks so much for joining us for this episode. We hope you enjoyed it as much as we enjoyed making it. Be sure to subscribe and share this podcast with your friends and colleagues. We'll see you next time.
The Innovation Forum AI podcast is produced by Zoila Leiva Rioja and brought to you by the WHO Hub for Pandemic and Epidemic Intelligence. We'd love to hear your feedback and ideas. Reach us at pandemichub@who.int.